Great day. It's the only outpatient surgical center in Greater Houston that offers a new technology to patients with failed kidneys. It allows them to get life-sustaining dialysis treatment. Dr. Ruchdi Barakat with Humble Vascular Surgical Center is here to discuss how this treatment is becoming the new standard of care. Good morning.
Good morning, Deborah.
All right. There are lots of big facilities that offer services, but when you specialize the way that you all do, you can kind of wrap your arms around a patient even more. Explain the philosophy behind Humble Vascular Surgical Center.
So we are dedicated to delivering compassionate and effective care for dialysis patients, which is specifically patients who have failed kidneys that require hemodialysis, peritoneal dialysis, hemodialysis. And we do this in a complete outpatient fashion in our surgery center in the Humble area.
All right. Percutaneous arteriovenous fistula. That's a mouthful right there. People who are going through dialysis might know what that is, but explain to us what that is and how this is different than many cases.
So an AV fistula is a connection between an artery and a vein, and historically and typically that has been performed using surgical technique. In the last 2 years, we've been performing this using a percutaneous technique, which means through the skin, and using thermal technology. So instead of making a 3-inch cut in the skin and having surgical scar, going into general anesthesia, we do this using a small needle, and we go through the catheter that you just saw. It's specifically the ellipsis catheter, and we weld the connection between the artery and the vein. So the patient doesn't have a surgical scar, they didn't go through general anesthesia. It's a short duration procedure, and it's very effective.
How long after having the procedure can they get services done?
So typically after creation, the patient will require a series of maturation process, and roughly 2 to 3 months before the fistula can be used for hemodialysis.
Okay, so obviously you mentioned a couple of things that make it better than the surgical AVF. You don't have that scar, as you mentioned, and some other things that make it easier?
Well, the most important part is the maturation rate and the patency rate. In layman term, they survive better and longer. So the fistula actually graduate to be used, and it stays open longer versus the surgically created AV fistula.
Wow. Okay. Since the last time you were on the show and talked about this, you have seen hundreds of patients, and that's got to make you feel good. But it's amazing how this change can really change someone's life. What have you heard from patients?
So interesting enough, I had a patient yesterday who I saw, and he said, you're fantastic. I've been using this for the last year with no issues. We've done over 120 AV fistula creations and over 300 maturations. And about 80% of our patients are actually already on dialysis. And this is our first patient, and this is 5 weeks post-creation. You can see the fistula already maturing in this case.
Yeah, you deal with all kinds
surgical scar
of arterial disease. So what other patient would come to your center?
So other than patients with that are on hemodialysis that have failed kidneys, patients with diabetes, high blood pressure, that have problem with their legs and have peripheral arterial disease, we have very experienced physicians that actually can fix their legs and make them walk better and have less issues and prevent amputations in the future.
Yeah, we're hearing more and more and more about arterial disease, and I'm sure that's for a number of reasons. One is our lifestyle. The other is we're just living longer. Are there things that we can do to prevent it? But of course, if we're already in the thick of it, we know that we can get services with you.
Well, control blood pressure, control your blood sugar, obviously eat healthy, and, you should not have to see me.
Yeah, we shouldn't have to see you, but sometimes, things are genetic.
Right.
Sometimes it just doesn't work out that way, as we know. So we do come see you. And besides this particular service, what patients have also commented about you, I know a couple of people who've gone to you all, is just that you are so compassionate, so kind. Patients, oftentimes enter scared and confused. You take the time to educate them about what's happening and make them feel comfortable in the setting.
Other than, explaining them the procedure, we have a lot of, presentation videos that shows what we actually going to do. We present to the patient step by step in layman term what we're actually going to do for them. The patients are awake during the procedure. If, as example, this is the video of the ellipsis procedure. We show the patient exactly what we're going to do. This is the needle entering the artery, and this is the ellipsis catheter locking in the artery to the vein. And, patients are not undergoing general anesthesia. So the patients are basically half awake. We give them moderate sedation to make them comfortable. So we go step by step with them about what we're going to do. So there's no scare about going to sleep and not knowing what's going to happen to me during the procedure.
Yeah, yeah. At the end of the day, what you're doing is adding quality years of life.
I appreciate that. Thank you.
All right. Dr. Barakat, thank you very much.
Thank you for having me again.
And if you are on dialysis, call Humble Vascular Surgical Center right now and schedule a free evaluation to see if you qualify for ellipsis. Also, if you're diabetic and have high blood pressure and want an evaluation for peripheral arterial disease, call now for a free screening. The number is 346-616-5862. Again, that is 346-616-5862, or visit their website, Humble